Welcome back. Heart disease is considered the greatest health threat to Americans and is the leading cause of death worldwide. That's according to the American Heart Association. So that's one reason the month of February is designated as American Heart Month, and as part of an effort to raise awareness about early detection of heart disease, some local doctors are offering some preventive screenings.
Yeah, and it's the reason why Allie Martin visited Cardiology Associates of North Mississippi and underwent crucial tests experts say can help with early detection and prevention.
My visit to Cardiology Associates of North Mississippi began with a trip to the lab for blood work. Then it was on to the X-ray room where I would get an electrocardiogram or EKG to measure electrical activity of the heart.
Let your left arm go down by your side.
Once the EKG was complete, it was time for a CT scan to measure any calcified plaque in my arteries. Dr. Benjamin Blossom says early detection is key to help reduce a patient's risk for heart disease and stroke. That's why doctors are encouraging more screenings before any symptoms develop.
Cardiology in the past has not been good at screening. We've been very reactive, I think is a nice way of putting it. People have events, we fix things then. What we're trying to be is proactive.
All three tests took less than 20 minutes. Then Dr. Blossom went over the test results.
EKG looks good here.
Okay.
Nice normal rhythm, normal rate.
My good cholesterol or HDL was 47, which is normal. The bad cholesterol or LDL was 118. Ideally, it should be below 100. I'll get mine checked again in 3 months. My calcium score, which measures calcified plaque in the arteries, was 17. A perfect score is 0. Anything below 100 is considered good. Dr. Blossom says it's important to stay ahead of any cardiovascular disease, and the diagnostic tests are a great way to do that. He says awareness about the importance of early detection is increasing, but could always be better.
We still see the patient who a family member or a family friend has an issue, and they use this as a way that, well, they use the event that happened to somebody else as a reason to come get this test. We would encourage people to not wait for something like that, but to go ahead and come on in, let us screen.
While genetics also play a role in the likelihood of heart disease, lifestyle choices such as exercise and a healthy diet also make a big difference.
30 to 60 minutes of exercise a day is actually what's recommended by the American Heart Association as adequate exercise. You want to get your heart rate up. A lot of people say, well, I walk a lot at work. Well, walking from their desk to to the factory floor or whatnot, really what we're talking about is sustained heart rate elevation.
People can have heart disease without having any symptoms. That's why Dr. Blossom says it's important to have the test done, especially the calcium test, to make sure there are no underlying risk factors before a major medical issue develops. Telling your story in Tupelo, Allie Martin, WCBI News.
And other ways to prevent heart disease include not smoking, maintaining a healthy weight, controlling blood sugar, and getting regular checkups.